it will not have escaped people's attention that the pressure on the emergency department nationally, but particularly in Derriford, has been really high, with really long ambulance waits, really long waits in the hospital emergency department, which then projects onto the surgical assessment unit with long waits. And when you've got men and women who are unable to pass urine and they're in extreme pain, then it's unacceptable for them to be remaining without treatment for long periods of time. So one of the ways to circumnavigate that is, now that we've got a fantastic new one-stop unit with all the facilities here to diagnose and treat people, we can divert people away from those high throughput areas and treat them in a much quicker way so that they can go home with their management in place.
So we have set up the Urology Same Day Emergency Care service here in the Chestnut Urological Investigation Unit. This service allows us to assess and investigate and provide treatment for patients with common urological issues that would normally be dealt with in primary care or via ED. The benefit of the service is that we're able to see all of our individual specialist patients here in the unit and prevent them from being admitted via SAU or primary care or even ED, which has helped to hopefully reduce waiting times for patients, but hopefully provide a better experience for them as well. It usually means that we can do everything all in one day. So our service started officially on the 29th of April. We were able to start taking patients from that date. The service is run via dedicated bleep, which is staffed every day between 8:30 and 4 o'clock. It means that we can take patients directly from primary care or ED, see them here in the unit. So lots of our patients arrive from our point of view with quite common urological issues, things like acute urinary retention and blocked catheters. Typically, we will get a bleep about a patient, we'll accept the patient if appropriate. They are seen here in the unit. They'll get assessed by an advanced nurse practitioner or a surgical care practitioner with input from our registrar if needed. They'll have investigations done on the day. That might include scans, blood tests, formal consultation, and then we would treat them accordingly, whether that might require a catheter inserting or a period of monitoring or a catheter flush. They'll then be provided with aftercare, kept in the department for a little while to make sure that they're doing okay. And then we provide discharge summaries for primary care. It's been great for our patients so far because it's enabled us to see them in a specialist environment, and often these patients know us already. It saves them waiting in ED and in primary care for long periods of time, and has overall, I think, given them a better experience. As far as we're aware at the moment, whilst there are a couple of other UIUs within the country, doing urology at SDEC is quite a new service, so this is something we're really proud of.
So we are building a template which can hopefully be used nationally by the Get It Right First Time team. They're looking at that being promoted as the best practice for this kind of care. It's a great model in which patients can be seen, can be referred in from GPs. They get vetted obviously for appropriateness for coming to our department, and then they can be put into the appropriate treatment pathways within the hospital. The other facility we have is the ability to use a virtual ward where patients are reviewed at home. They can have bloods taken, they can have urine outputs reviewed, they can have observations taken, and generally being looked after by the team out in the community with red flags so that they can be referred back into us for safety netting.
But it's been a really proud moment to open. It's been something that we've been wanting to do for many years so that we can have our own patients in-house, so we know what treatment they're getting, we know what they've had already, so they're getting that specialist service. So using kind of the healthcare assistants that we've got who are our band 3s who have been amazing, it's given them a real challenge and working to the top of their scope of practice, which has been really good. Being given that opportunity to make a big difference to the wider team has been really good, and also to the organisation, where it's very obvious that we've got quite a lot of challenges through ED and SAU, so to be able to be a small part of that and reduce the number of people that are going through those departments has been really good, and something that we're really exceptionally proud of. So yeah, it's been really good.
Well, so we're starting small. So we're basically doing catheter care and urinary retention pathways at the moment, but we do hope to expand this to procedures like torsion and potentially the stone acute presentations, who hopefully will be able to go and have CT scans directly and then come directly then to have their stones treated in the lithotripsy unit. So this is going to have spin-offs. This is just a small start, but I think we've seen about 40 patients so far in the last few weeks. Just the putting this together requires an amazing team. It requires a vision, it requires the management and the input. The fact that we've had the investment in the Urology Investigation Unit has given us the opportunity to be able to offer and deliver this. So I can't emphasise enough the fact that this is a huge team effort, and the surgical care practitioners and advanced practitioners who operate it are doing a great job. We're learning as we go.